None of us like unexpected medical bills. We don't like to be surprised thinking that a service is covered by our health insurance and then come to find out it was not. None of us want that to happen for sure. And the same thing holds true when we're on Medicare. Medicare is wonderful insurance, but it does not cover everything. So in this video, I'm going to show you what to expect when it comes to bills with Medicare, what's covered, what's not covered, and how that Medicare system is going to work. So the first thing we have to do is understand there are some things that Medicare is not going to cover. It's a small list for sure. Medicare is great insurance, but there's some items that you would be 100% out of pocket on. And the first one that is very important is long-term care facilities. Now, this is someone that's in a nursing home. Now, I want you to know that Medicare does cover skilled nursing facilities. That's when someone's had maybe a stroke or a knee replacement, hip replacement, and they're going through rehab. Medicare will cover that kind of care because there's a high likelihood of recovery. But again, that's rehab. Long-term care facility means someone's in a nursing home and they need what's called custodial care. Custodial care means that they need help with maybe bathing or dressing or eating, and they need substantial assistance with that. And Medicare is not going to cover the long-term care custodial services. Now, there is one government agency that may do that if someone has low income and low assets, and that would be Medicaid. They pay a lot of long-term care facilities, but Medicare is not going to participate in those bills. Number two is cosmetic surgery. And what I mean by that is that this is someone who is having an elective cosmetic surgery. If something's medically necessary and there's a cosmetic surgery related to that, Medicare would pay for that. But if it's an elective type cosmetic surgery, you're on your own with that particular bill. Then number three would be massage therapy. Massage therapy. Now, I know there's a lot of people that are helped greatly by massage therapy. In fact, my wife is. She loves getting massages. But Medicare is not going to cover that. Now, there are some things that Medicare could cover, like at a chiropractor's office. They will cover sometimes acupuncture or adjustments of the spine, as long as there's some acute back pain and some other rules that go along with that. But the point is, massage therapy is not going to be covered by Medicare. And then number four, routine physicals. Routine physicals. Now, most of us during our working years had routine physicals covered by your insurance company. It's a wellness benefit that's provided by most group plans, and that would include labs and different tests and those kinds of things. But when you're on Medicare, there's no routine physicals. Now, Medicare will cover many things preventive, but not everything maybe you're accustomed to on your group plan. Medicare covers you for a welcome to Medicare physical the first year that you're on Medicare, and then after that we have annual checkups. But there's certain things they are going to cover, and so you always want to make sure that you're getting a checkup that is considered to be preventive that Medicare is going to cover. But as a general rule, just routine physicals that you may have been accustomed to, probably not going to be covered by Medicare. And then number five would be concierge services. Concierge services. Okay. Now, concierge medicine would be when you actually pay a flat fee to a doctor to have access to that doctor. Those are called concierge docs, and Medicare is not going to cover concierge medicine. And then number six would be this: anyone that is a non-Medicare provider. Non-Medicare provider. When you go on Medicare, one of the questions that you have to ask the doctor is, do you take Medicare? And after that, if they say, yes, we take Medicare, then you have to ask them, is this service they're recommending, maybe a surgery or lab or any kind of procedure, is it covered by Medicare? But if you go to someone that says, no, I don't take Medicare, and if you get services from them, even if it would generally be covered by Medicare, but because you're using a non-Medicare provider, you would be 100% out of pocket on that. And then number seven would be foreign travel. Foreign travel. And what I'm talking about here really is foreign travel emergency. I had a lady recently that was in Costa Rica that fell getting out of the shower and broke her femur as well as her hip. Okay, that's a foreign travel emergency. And Medicare did not cover that because Medicare only covers us inside the U.S., all 50 states, as well as the U.S. territories. Puerto Rico and Guam and the Virgin Islands, those kind of places, you're covered by Medicare. But if it's outside of the country, as this lady was in Costa Rica, that's not going to be covered by Medicare. And then number eight, most dental is not covered by Medicare. Most dental. Now, there could be some real extreme cases where some dental may be covered. Someone has cancer in the mouth or something. There could be some dental issues. They're covered by Medicare. But as a general rule, the things that you and I need could be extractions or fillings or root canals or crowns, cleanings. Those kinds of things are not going to be covered by Medicare. All right, as well as dentures. Medicare doesn't cover dentures either. Now, Medicaid may. Sometimes there's plans where that can be covered, but Medicare, as a general rule, not going to cover those items. And then number 9, eye exams. Eye exams. Now, what I mean by this kind of eye exam that Medicare is not going to cover, this would be if you're going in to get a new prescription, new set of glasses or contacts. The eye exam for that is not going to be covered. Or if you just simply want to go in and say, Doc, I want to make sure my eyes are healthy. That is not going to be covered by Medicare. Now, Medicare covers you very well with eye problems, diseases, and different issues, glaucoma, cataracts, macular degeneration, all those things covered very well by Medicare. But when it comes to eye exams for eyewear or for just a preventive checkup, that's not going to be covered by Medicare. Now, if it's a medically necessary eye exam because you see floaties or you're having vision problems, that's covered by Medicare for sure. But just not that's just kind of the routine physical type things. Now, the exception would be if you're a diabetic. Actually, diabetics get 2 routine eye exams a year because their diabetes could have an impact upon their vision. All right. And then number 10 would be hearing aids. Hearing aids. Now, there has been a lot of talk about Medicare adding hearing aids to their benefits, but so far it's just been talk. There's been some legislative proposals, but nothing has passed yet as far as hearing aids, all right? And so you'd be on your own for hearing aids. Now, if I have a disease within the inner ear and those kind of things, certainly covered, but not because of a hearing issue, all right? And so those are items that you are going to be out of pocket on. Now, I do want to mention before I go to the next slide is this. You actually can get some insurance for these kinds of items here. For dental, there's dental plans, there's certainly vision plans, even hearing aid type plans, or you can go with an Advantage plans and some of those items are going to be covered. But I just want to make sure you know that if you get a bill for these kinds of items, that it could be fully on you.
Hey, my name's Josh Music, and if you've been enjoying my dad Marvin Music's content, you really need to go to our website, MedicareSchool.com. When you go there, you'll be given the opportunity to download a free 1-hour Medicare Essentials workshop, and it's going to take you all the way from Medicare A to Z. By the time you're done watching that workshop, you're going to know how to enroll in Medicare, when to enroll in Medicare. You're going to know the differences between Advantage plans, supplemental plans. You're going to know how to get drug coverage. You're going to know everything you need to know to get the best coverage possible. So go ahead, go to MedicareSchool.com and watch the Medicare Essentials workshop.
Now let's talk about those things that Medicare will cover. And folks, the bulk of services that you're going to need for your health care is going to be covered by Medicare. But here's the real key, and that's this. When something is determined to be medically necessary by Medicare, that really is the key. Medically necessary, and you're seeing a Medicare provider, it is going to be covered by Medicare. The second component that's very important is we want to make sure that we have correct coding, right? Correct coding. In other words, that claim that's given to Medicare, either from the hospital or from the doctor, it needs to be coded correctly, because if Medicare doesn't like the coding on it, they're going to deny the claim. I had one recently at a hospital. It wasn't a very large bill, $15,000. That was not getting paid. Our client called us. We got involved and called Medicare to find out why it wasn't paid. Well, the hospital wasn't coding everything correctly, and so they gave us the proper codes. We called the insurance company and said, here's the codes you need to be billing, and Medicare took care of that. So the point is, things have to be medically necessary with proper coding, and Medicare is going to cover very, very well. Now, as we continue our discussion about Medicare bills, making sure you don't get any surprises and you know exactly what to expect, you have to understand there's actually 2 different ways in which your Medicare is going to work. One of 2 ways, and you have to choose which system is going to be best for you. So one way is to use original Medicare A and B, and you get a supplemental plan to fill in the gaps. That's one way. The other way is to use an Advantage plan. All right? Now, as we talk about bills and your out-of-pocket responsibility, depending upon what system that you're going to be involved with, will determine the bills that you're going to receive. And both of these systems are really, really good, but they're going to be different. So I'm going to take a few minutes and explain to you what bills you could expect depending upon whether you go with the supplemental plan or with an Advantage plan. Now, original Medicare is broken up into 2 parts, Part A and Part B. A is called hospital and B is called medical. And A is pretty much everything that's going to be on the inpatient side of Medicare. This would be hospital services and skilled nursing facility services as well. Part B is pretty much everything that's going to be outpatient type services. This this would be also all doctor-related services, whether that's a doctor that you see in their office or they treat you in the hospital. It is the B of Medicare that's going to pay for all the doctors, all right? So now on each of the two sides of Medicare, you have some financial responsibility. Medicare pays first and pays pretty well, but there's always going to be a balance that is going to be remaining, except on preventive services. Medicare covers the preventive services at 100%, but other than that, you're going to be responsible for something financially. And so the way that works is we call these gaps in coverage. So what we have on the A of Medicare and the B of Medicare, we have three financial gaps, three things you're responsible for. So on the A of Medicare, this year, and by the way, this is being shot September the 28th of 2022. Just yesterday, the new numbers came out for 2023. But this year, the deductible is $1,556. That's actually going to be $1,600 in deductible in 2023. Now, this deductible means that if you go to the hospital, this is all that you have to pay out of pocket for up to a 60-day stay. You pay the deductible, and then Medicare pays the rest. The bill could be 50 grand, the bill could be $1 million, doesn't matter. Anything between 1 to 60 days in the hospital costs you the deductible only. Now, that deductible is not annual. It can occur more than once in a year. Basically, that deductible is tied to what we call a benefit period. And so a benefit period begins when I'm hospitalized, and then I'm discharged, let's say 7 days later. And from the date of discharge, my benefit period will last for a full another 60 days. So from the date of discharge for the next 60 days, if I'm re-hospitalized during that time period, I'm still in the same benefit period, therefore under the same deductible. But if I'm hospitalized and 7 days later I go home and the next 60 days nothing happens but happens after that, or then I have to come back to the hospital, I would owe that deductible again. Now that covers this for up to a 60-day stay in the hospital. Now if I'm in the hospital longer than 60 continuous days, number one, you're really sick, and again, it begins to get expensive. And so the reason for that is now we have these daily copays to the hospital daily. And so what happens is month 3, I would have to pay $389 every day. This is going to $400 a day in 2023. So that means month 3 would cost me $12,000. And then they double the copay month 4 and month 5. And that's going to be $800 next year. So that would be basically $24,000 a month for month 4 and another $24,000 for month 5. Now again, those don't happen often. We call those extended stays. But when they do, you can see they are very expensive. And then lastly, on the A of Medicare, we have skilled nursing facilities. Now, here's the way this works. Medicare says that days 1 to 20 absolutely cost you $0 as long as you were in the hospital 3 days or longer prior to going to the skilled nursing facility. That's the requirement. 3 days or more, Medicare covers everything in the skilled nursing stay the first 20 days. But then after that, days 21 to days 100, I have a daily copay I'm responsible for. This year, it's $194.50. Next year, 2023, that will be $200 a day. The average person right now spends about 30 to 35 days in a skilled nursing facility. All right, so they're spending $2,000 or $3,000 out of pocket. So that's the way A is going to work. Now that takes us into the B side of Medicare, which is called medical, or the outpatient side, and the doctor services side of Medicare. Now you'll notice this year, 2022, the premium for Part B is $170.10. In 2023, that's going down to $164.90 a month. That comes out of your Social Security check, or they bill you for this quarterly. Now, that amount is correct. It's based upon income, and the income for next year in 2023 is $97,000 for anyone that's single. Okay, a couple would be $194,000 for a couple. And so as long as we have these numbers here or below, then that is going to be correct. Remember, $164.90 in 2023. If we're going to be above those numbers, then we have to pay an additional amount that's called an IRMA. It's a surcharge for high-income people. So I've done a lot of teaching on that. You can watch some of my videos with the IRMAs. So what's covered under Medicare would be everything here on the B side, outpatient services, durable medical equipment, and all doctors. And so here's what you're responsible for. We have a deductible this year of $233. That's actually going to go down next year. It's going to be down at $226. And so the first $233 this year of anything on the B of Medicare will be your financial responsibility. You're going to get a bill for that. So that's not shocking. We would expect that on any of these services. And then after that bill, that B deductible, then we're responsible for 20% co-insurance. So the way it works is Medicare is a fee-for-service system. Medicare covers thousands of services. There's a predetermined fee that that provider knows they're going to get. And And of that fee, Medicare pays 80% on the B side, and you as the Medicare recipient pays 20%. Now the problem with your 20% we call coinsurance is if you don't have any other insurance, it never stops, just keeps going and going and going. And sky truly is a limit on the B 20% coinsurance. And then lastly, there are some physicians that will see you as a Medicare patient. They're a Medicare provider, but they add to the bill. Again, this isn't very common. About 1 out of 10 doctors will do this. But when they add to the bill, that's called an excess charge, and it's an additional 15% added to the Medicare bill. And Medicare doesn't pay any of that 15%. That is fully on you. So again, if you see a provider that charges excess, you're going to get a bill for that unless you have insurance to cover that. All right. And so the whole point is this is the original Medicare system. And so if you decide to stay in that system, what most people do when they look at these 6 different gaps they're responsible for, they don't want that kind of liability. They don't want to get those kind of surprise bills, the 20% that never stops, the doctor that adds to the bill. And so what they do is they will buy a supplemental plan. Now, I'm not going to go into all the plans right now. I'll just tell you about the most common plan today is actually called the G plan. It's called the G plan. And the G plan is definitely the most popular, the most extensive coverage that most people can get. Now, there is a plan called the F plan, but you have to be born before January 1st, 1955, or starting Medicare prior to January 1, 2020 to get the F plan. The F plan is actually a full coverage plan. It fills in all the gaps. But if you're born after January 1st, 55, starting Medicare after January 1, 2020, you can't get an F plan, and that's why the G plan is the most popular today. So here's what it does. So we know Medicare pays well, but you're responsible for these gaps. So the G plan will pay all of that, no matter how many times the deductible happens in the year. It covers all of your co-pays for extended hospital stays, and it covers all that for your extended skilled nursing stays. So all the gaps are covered. On the B side of Medicare, it will pay the full 20%. You never see that, and it pays the full 15% as well. So the only gap you're responsible for would be $233 this year, and again, the B's going down on the deductible next year to $226. So I'm not shocked and surprised by getting a bill once a year, that annual Part B deductible. But if I have a G plan, I won't have to pay for any of these whatsoever. All those will be covered by my supplemental plan. I transfer the risk of those gaps to that company. I pay them a premium to take that risk from me, and so I should get no surprises other than the B deductible on an annual basis. So that's one way in which you can use your Medicare, one way in which you can be for sure exactly what you're going to be billed for. Hey, if you need help getting your Medicare all set up and making all those decisions to make sure that you have the right coverage, we would love to help you. In the pinned comment section below, you can see a link there, and you can actually set up an appointment to meet with one of our Medicare guides. It's a virtual appointment, and they will help you from A to Z, do everything that you need to do from enrolling into Medicare to selecting the right Medicare plan so that you'll have confidence that you have the right coverage for your situation. Now, the second way in which we can use our Medicare benefits is to use an Advantage plan. Now, to have a supplemental plan, I had to be enrolled in A and B. Also, to have an Advantage plan, I have to be enrolled in A and B, which means what? I'm going to have to pay that B premium. And so right now, remember, that's $170.10 a month. Next year, that's going down to $164.90. So this is in 2022. And that is in 2023. All right, so we have to be enrolled in Medicare A and B to have the Advantage plan. These are actually called replacement plans. And so in this system, what's going to happen is there's some differences. Number one, if I have an Advantage plan, I will have a network of providers, of doctors and hospitals and specialists. Those are either HMO networks or PPO. We describe the HMO network with a smaller box that's closed. Smaller because you'll have less options in the HMO than you will in the PPO. Now, that doesn't mean that there's not sufficient options, but PPO always has more providers that are available. And the reason for that is because on the HMO, the provider does not get paid as much money. And so there are some doctors that are willing to take the HMO contract. Now, for you as the consumer, you'll find that the HMO is going to have lower co-payments, as a general rule, and also going to have lower max out-of-pockets. And they've thrown a few more benefits on the HMO than the PPO. Now, the big difference is going to be sometimes the HMO will have restrictions. You may have to see a primary care doctor before you can see a specialist. In other words, you have to have a referral. That's a restriction. Certainly going to have less choices. The third restriction is out-of-network. If you're on an HMO, you can see we use the closed box. You cannot go out of your network unless it's an emergency situation or an urgent care situation. Then you can go out of network network. But if it's not those two situations, you have to stay within your network. On the PPO, we can go out of network. We have the right to do that. Now, when I go out of network, I'm probably going to pay more in co-pays and more max out of pocket, but I do have the right and the privilege to go out of the network. Now, if I had a supplemental plan, I don't have either one of these because my network is Medicare. With supplemental plans, you can go to any provider that takes Medicare. With the Advantage, you're going to have to find some provider that's going to take your network plan. So here's the way these plans work and how you're going to be billed. Number one, Advantage plans have very low or no monthly premium. Now remember, I still got to pay that B premium, right? $170.10 this year, 2023, $164.90. Okay, but as far as the premium to the insurance company, there's usually no premium, or if there is a premium, it's going to be very low. Okay, about half the plans today have no premium. There's zero premium. And the reason for that, because instead of paying a premium like you would have on a Medicare supplemental plan, instead of doing that, what you're going to do is you're going to pay co-pays. And notice the way I word this, co-pays for most services. Now, there are some services where there's zero copay. Most of the plans allow you to see your primary care doctor for zero. They normally are going to allow you to go to like have a gym membership and a dental plan or a dental benefit that's added at zero. Your preventive is going to be zero. So there's a few things that are zero on the Advantage plan, but most services you're going to pay a copay. And so the copays are very reasonable. It may cost you $50 to see a specialist, maybe $200 to have an MRI, $350 a day to go to the hospital, but it's a copay system, and you pay those until you hit what is called the annual max out of pocket. So until I hit the max out of pocket, I'm pulling out my wallet. I have to pay copays. But once I hit that max, you put your wallet away and checkbook away, and now you're going to be covered by the plan 100%. And so right now, on average, those are going to be in the range of about $4,000 to $10,000 for max out of pocket, out of your pocket expenses. And then if we ever reach that max, then you're done for the year. And then these numbers will reset every January. And again, you start paying as you go. So you're going to pay your copays. All right. So as you can see, the supplemental plans, I pretty much got rid of all the copays, other than maybe that one small B deductible once a year, because I paid a premium to get rid of the risk. Here, I take on the risk of whatever healthcare services I need and whatever copay is attached to that particular healthcare service. So we're not going to be shocked by getting a bill for copays if I'm on an Advantage plan. Why? Because I didn't have to pay a premium for the plan. But I also would be shocked if I got bills that would be beyond my max out of pocket. If you get a bill beyond max out of pocket, simply don't pay it. There's some kind of a billing error that could be corrected. All right, and so this is kind of a pay-as-you-go system. So these are the two ways in which you have as options to use your Medicare benefits. And you want to be sure that you never have any more additional out-of-pocket expenses than what the max is if you decide to go on an Advantage plan. And if you get a G plan, you shouldn't get any bill beyond that small B deductible. So when it comes to bills and out-of-pocket expenses, what is it that we should expect from these two systems? Well, certainly if I have a supplemental plan, I still had to pay my Part B premium, right? This year, $170.10, next year, $164.90. And the same is true here. Okay, I've got to pay my Part B premium if I have an Advantage plan. Over here, if I get a supplemental plan, I'm going to have a premium for that G plan. Now again, premiums vary all over the country, but on the average, I'd say these are going to be in about the neighborhood of about $125 on a monthly basis. When it comes to an Advantage plan, most of the plans have a zero premium. All right. Now, when it comes to out of pocket, if I had that G plan, once a year, I have my B deductible. This year it's $233. Next year it's going to be $226. And again, that's once a year. And after I've done that, I have no additional out of pocket expenses. If I take that Advantage plan, what's going to happen? I'm going to pay as I go, right? Now, those are not going to be, it's not going to cost me $50,000, but I could spend anywhere from $4,000 to $10,000 as I make my different copays. Another difference was, remember this plan over here, I didn't have a network. Over here, I had an HMO or I had a PPO network, and so these two systems are different. And so if I go out of network on my Advantage plan, if I have a PPO, I'm certainly going to get billed for that. Over here, as long as I find out if the provider takes Medicare, I never have to worry about any surprise bills being out of network. All right, and so you have an option whether you want to be on the supplemental plan or the Advantage plan. You cannot be on both, and both of these have their varying consequences as it relates to bills. And no matter who we go with here, we always have to make sure that we're giving the provider the proper insurance cards. So in this system here, what we have is we have 3 cards. that we use. And those cards would be A and B. Let's say I get that supplemental G, and then I also have a drug plan, and I have a separate card for that. So I would give them my Medicare A and B card and my supplemental G card, or whatever you have. That's two of the cards, and I have a separate card for the medications that I self-administer. So when I go to get a prescription at CVS or Walgreens or Walmart or wherever you go, you're going to give them that prescription drug card. If I go in this system, what happens? Yes, I had to be enrolled in A and B, but I put my A and B card in a safe place because an insurance company is going to issue to me one card, and that card is going to take care of everything inpatient, outpatient, as well as my prescription drugs. So as you can see, in both of these systems, we are going to have some out-of-pocket expenses. Over here, I had to pay my Medicare B premium. I had to pay the supplemental company. And then after that, the only thing I was responsible for was a B deductible. If I get any bills beyond that, do not pay them. There's some kind of a problem. In this system, yes, I had to pay my Medicare B premium, but I probably didn't pay a premium to the insurance company because now I'm paying as I go. And I would never have to pay more than what that annual max out of pocket is. And if I get something beyond that, you certainly don't want to pay it. There's some kind of problem that needs to be corrected.